pain sufferers are getting a new lease on life thanks to alternatives to treat pain.
Yeah, and here to walk us through how some people are getting relief without an abundance of medication is Dr. Vu Deng with the U.S. Pain and Spine Institute, along with one of his patients, Varia Hubbard. Welcome to you both.
Thank you for having me on the show. It's hard to follow Elvis, but I'll try my best.
If we break out into song, don't be surprised. Now, Dr. Deng, I want to start by asking you, chronic back pain is something that a lot of people are experiencing. So tell us a little bit about your institute and the kind of work you do.
Sure. First, I'll start off with saying that chronic pain is one of the most common reasons that patients go seek a physician's help. Actually, in America, annually, about 86 million patients suffer from chronic pain, and that's why they go see physicians. Most of the time, an acute pain episode is successfully treated by a primary care physician. However, in a lot of cases, that isn't the case. Then patients are referred to specialists like myself, a pain management specialist, and that's where I go and do various injections for the patient.
But by the time a patient's gotten to you, they could potentially be going through almost a medication overload, right?
That's a good point you bring up, and that's something that I feel very passionate about, which is to help deal with the opioid epidemic in our nation. It is now a well-known fact that there's a huge ongoing epidemic with patients suffering from opioid overdose. As bad as in 2012, more than 260 million prescriptions of opioids were written in America. That's enough for every single adult in every American family to have a pill bottle.
So for folks at home, what would an opioid be? What would be, one of the name brands or something that you would see?
So an opioid is a medication that treats pain, such as the common brand name is Norco or morphine or Dilaudid. It treats pain effectively. However, if not managed successfully or appropriately, it can lead to a variety of different side effects, including decreased bone density, decreased immunity that leads to increased risk of infection, unintended weight gain, hair loss, as well as uncontrolled hormonal balances. The most alarming one about opioid side effect is the fact that it can lead to respiratory depression, which leads to respiratory arrest and ultimately death.
Now, while medication is part of a treatment plan, and we will talk about some of your treatment options in just a moment, I want to bring in your patient here, Varia. Tell us a little bit about what you were suffering from and how the Spine Institute helped you.
I suffer from a condition called swelling within the SI joints. And it's a condition that comes from having babies and the pelvis opens. You could have it early on or you could have it later in life. When I first started seeing Dr. Deng, he told me that the goal for me was to be off of pain medication.
To get off of medication
entirely? To get off of medication completely. Wow. And successfully, with the procedures that he's performed for me, I was able to do so.
So talk about your life, though, before you had the surgery. I mean, you couldn't do a whole lot.
No, I would lay in the bed all day in pain, even with the pain medications. I couldn't do my job effectively. My job requires me to sit all day, so I couldn't even sit up in a chair.
Oh my goodness. So you were essentially completely immobilized, but today I've seen you walking around. I know you're walking now. So, I mean, do you feel like you have a new lease on life?
Yes, I do. Yes.
That is fantastic. I mean, how about that for a testimonial? Now, medication is something we've talked a lot about during this segment, but physical therapy is also a big part of what you do. And do you feel like oftentimes people are, overprescribed medications, but you would actually suggest they go through some sort of physical therapy?
Well, so what myself and my company offer at U.S. Pain and Spine Institute Healthcare is a multimodal approach to managing the patient's pain. When a patient gets referred to us, our company, we offer them various modalities at various times, so preferably in the beginning to combat the pain. We are the only company in the greater city of Houston where we have a pain hospital dedicated to just managing chronic pain patients, including physicians, nurses, as well as surgeons. Furthermore, we have our own imaging facilities, which when a patient needs an X-ray, an MRI, or a CT scan, the patient goes to us, we have the imaging facility, it gets uploaded to our desktop for us to view right away. Perhaps the most innovative thing that we do as a company is offer genetic screening for our patients. Now, how your liver metabolizes medication is different vastly from how I metabolize it, because we have different genetics. So a lot of physicians out there prescribe medications without guidance from the genetics profile. when you come to me, I will to screen how your body breaks down a medication, Norco, for example. If you metabolize it quicker than I do or slower. And in doing so, we can use that to guide our medication regimen to minimize the side effects and maximize the benefits.
I'm not sure if I've ever heard of a doctor doing that for
It's-
pain medication. Okay, let's talk about our buddy right here.
Sure, this is my friend Mr. Skeleton here.
Now, you have a few demos for us, though. So
I do,
part
I
of your
do.
treatment plan is injections. We're just about out of time, but if you could quickly show us some of the demos.
So let's turn them around. These are the various points in the spine I would do injections on. They will include steroid injections under live X-ray guidance to increase the efficacy of it and accuracy. Now, after injections and medications, patients may get surgery to improve pain. However, there are a lot of patients out there, if you talk to them, and they have pain persistent still after the surgery, and they're having to take more and more medications. And I want to tell them that that's not the end. There's something called spinal cord stimulation that uses electrical frequency to communicate with the spinal cord to decrease and inhibit pain transmission.
Dr. Dang, it's a wonderful thing that you're doing,
Yeah.
helping all these people. We could talk about this all day. I know you have some more
I
demos,
certainly
but
can.
we will save that
You are
for
very
another
passionate
time.
about it. I love
Thank
it.
you for
I
having
love
me.
it.
Thank you for being here, and thanks to Varia as well. For more information on pain management, you can visit the website uspshealthcare.com, or you can give them a call, 713-973-7246. I can barely see that number there.